Hi all, I'm Bincy here. Today I'm back with medical surgical nursing male reproductive system and the topic is cryptorchidism. Cryptorchidism is a congenital disorder. It can be also said as undescended testis. Usually what happens is like when a male baby born, so after the birth only, the scrotum, the testis is descending to the scrotum. Okay, it will be present in the abdomen. From there, after birth only, this gets descended to the scrotum. Okay. Now, what is this condition? Is like in the word or in the condition itself, I said it's an undescended testis. That means the testis has been not descended to the scrotum. The absence of testis in the scrotum, either one or both the scrotum. Fine, both the testis is absent in the scrotum. So it's a congenital condition. Now, what can be the etiology that can cause cryptorchidism as exact cause is idiopathic? It can be due to some hormonal changes also, male sex hormonal changes like HCG and all. Okay, that changes can be there. Then any genital factor or smoking mother, then any exposure to any pesticides, fine. Then it can be also a risk factor of diabetic, either like diabetic 1, diabetic 2, gestational diabetes. Any one of this can also have an after effect or a cause of congenital disorder as cryptorchidism. What are the clinical manifestation? Usually there is no clinical manifestation. We can say only thing is like the person will not feel the testis in the scrotum. Okay, in medically we can say that non-palpable testis. That is the only clinical manifestation in cryptorchidism. Then what are the complications? If testis is not there in the scrotum, what can occur? Infertility. Okay, then testicular cancer can also be seen. What are the diagnostic evaluation through which we can confirm cryptorchidism is like usually through physical examination, especially by palpably. Okay, palpating. Then if that is also not there, to confirm diagnosing we can do a trans illumination test. Trans illumination test means it's nothing, a test which is done on bedside itself but in a dark room, because a beam of light will be flashed to the organ. In this case now that is a scrotum, right? Through in the scrotum area, beam of light will be passed. If the light is passing through the organ, that means the organ is empty or there is no fluid filled cavity or something. It's empty, nothing is there in it. Fine. So that is the confirmation diagnosis. Then what can the treatment we can do is like as we discussed in the clinical manifestation, it can be due to hormonal changes. So as if it is a hormonal changes like HCG, the level of male sex hormone testosterone can increase in the chance of undescended testis will move to scrotum. So once if it is due to the effect of testosterone, so testosterone will be given, so that normally sometimes after because of the changes after giving the treatment, sometimes it might come by its own from the stomach, it might come descended to the scrotum also. Surgically we can also do that. Fine, that is orchiopexy, that is placement of testis in scrotum should be accomplished by the age of 5. So not before 5 and not after 5 also. Usually people do after 5 also, but not before 5 because baby is very small. Then orchiodectomy will be also done, that is the removal of testis. From the stomach, the testis will be removed and then it will be placed in the scrotal area. Fine. So this was all about cryptorchidism. I hope you all understood. Have a nice day. Take care. Bye.